Welcome to the Harvard Health Minute. I'm Dr. Terry Schrader. It's no secret that sugar consumption is at an all-time high. One report says the average American eats over 31 teaspoons of sugar a day, and it's not good for our bodies or our brains. To teach us more about sugar and help us to reduce our sugar intake is Dr. Naidoo. You are an instructor in psychiatry at Harvard Medical School and a professional chef. Welcome.
Thank you, Terry.
You've brought some food for us to help teach us that sugar sometimes hides in our foods. Can you tell us more?
Sure. Firstly, there are natural sugars. If you had a tomato salad or you ate a banana as a snack, that's a naturally occurring sugar, and it's healthy for you because in addition to the sugar you're consuming, which in a tomato would be about a teaspoon, you're also getting your vitamins, minerals, and fiber, and a few other things. So it's a good thing and it's healthy for you. And it's part of a healthy diet.
And there's no restrictions on that. So the sugar that occurs naturally in food, really no restrictions.
There are no guidelines or restrictions around that. We just encourage people to eat it as part of a normal healthy diet. And if you have a concern, always consult your physician.
Terrific. Vegetable juice.
So in vegetable juice, this is interesting because a cup of vegetable juice may have about 60 calories, 60 to 70 calories. And one might initially think that this is a really healthy drink, which in some ways it is. However, the difficulty is that the sugar is very concentrated, and in this instance, at least 2 teaspoons of sugar in just a cup of vegetable juice.
So even though there's no added sugar, it's the fact that it's concentrated.
It's concentrated.
So much fruits and vegetables in there that it's actually giving us a higher sugar intake.
Exactly.
And then what about something as benign, seemingly as benign as ketchup?
With ketchup, you know, in a single serving of ketchup that you might put on a burger, and most people put about 3 servings, you end up having approximately 3 teaspoons of sugar.
Wow. So sodas are a big no-no. We all know that. But
yes.
Show us the classic, even a small soda would have how much
Exactly.
sugar?
This is just over a cup of soda, and most of us drink more in a single serving. And that serving itself just contains 8 teaspoons of sugar.
Wow.
And that's added sugar.
So the federal government is trying to help us. They have recently passed guidelines. Tell us about those guidelines. How much sugar should we be having a day?
Sure, Terry. So the USDA and Health and Human Services have indicated that we should think about using less than 10% of our total calories for the day to be added sugar calories. So if you think about a diet which is 1,500 calories, think about your sugar calories being less than 150 grams, which for an average would be about 9 teaspoons of added sugar.
So somewhere between, or at least under 9. So that would be
Exactly.
the upper limit. We want
Exactly.
to have under 9 teaspoons of sugar per day, which actually sounds like a lot.
It does sound like a lot, but if you think about it, in a small serving of Coke, you would have used up more than your daily limit.
Now, what is wrong with sugar? What are the negative or bad physiologic effects when we consume too much sugar?
Terry, as you know, for many years now, we've understood the impact on heart disease and diabetes. But there's a new, and we have a better understanding now of metabolic syndrome, which includes fats in your blood and impacts on your body. For example, belly fat that is added on because of the sugar you consume. And those are much more significant in terms of disease.
And what about our brains? Does sugar affect our brains? We know it may alter the neurotransmitters, the hormones in our brain.
Exactly. So sugar now has been studied in how we think, in attention, and hyperactivity in children. So all of this in terms of our sugar consumption and effect on the brain are really important.
So help us on a day-to-day basis. Give us some tips to help reduce our sugar every day.
I think having awareness, eating a healthy, balanced diet, including more fresh fruits and vegetables, where the natural sugars are not something we need to worry about as much. Limiting everything else, limiting the soda, being aware of how many teaspoons you might be taking, and using the guideline to eat healthier and live healthier.
So not just reducing our sugary snacks and our sodas, but reading the label, see if it contains any sugar, and try to reduce that.
Exactly, and be aware of concentrated sugars and added sugars versus natural sugars.
Terrific. You've given us some very important information today, Dr. Naidoo. Thank you.
Thank you, Terry.